Well, we're here in the basement of the Valemount Public Library for an interesting new project that's happening here. And it is a project called the Rural Personal Health Record Project. And it is a project that is a partnership between the Rural Coordination Centre of BC, Bright Health, the Valemount Clinic, and the Northern Health Authority. And there's a two-day event going on here in Valemount right now, and we'll get to that in a second. And with me is Jess Rothenburger, who is the Rural Personal Health Record Project Manager for the Rural Coordination Centre of BC. I don't want to have to repeat that twice.
Exactly.
And Kyle Leishner, who is the Clinical Informatics Specialist with Northern Health. Gentlemen, thank you for being here.
Thanks for having us.
So first of all, what are we doing here? What is this all about?
Shall I go first?
Sure.
Yeah, so we've come to Valemount for these next couple days here, practically speaking, to sit down and help people register for the MyHealthKey personal health record. And that is so that people can have access to their personal health information digitally and also connect with their clinic here locally in Valemount.
Okay, so just to kind of to take it down to the grassroots level of it, it's an online system for people to be able to do this. Kind of describe just a little, very briefly about how it is.
For sure. So very similar to online banking. You can go online and you will be able to log into a secure system, which will give you access to online scheduling as well as some of your health information.
Okay, so you can schedule appointments with your doctor. You can access your lab results when they come through, exactly. and other things to come as it goes by. So I understand that this is kind of groundbreaking. So Valemount is the first to implement this system here. So yeah. Just why Valemount?
Well, you're right. Yeah, so Valemount is the first Northern Health Authority run clinic in the region to flip the switch and actually start using a personal health record, in this case, MyHealthKey. And the reason that we're doing it in Valemount is because Valemount is a very community-oriented place. It just so happens that we connected in with Dr. Ray Markham, works at the clinic. And it turns out that the providers, the physicians at the clinic are very inspired, forward-thinking, and despite being extremely busy and preoccupied with the day-to-day business of running a clinic and providing service, had the vision to partner with us, to take this on and to try it. And in addition, we counted on a core set of community patient volunteers that are willing to be part of this journey with us. It also happened that we were able to align with our partners at the Northern Health and also with our partners at Bright Health, which is the personal health record vendor, the actual solution provider. So kind of a really fortuitous partnership evolved between the health authority, the clinic, the patients, the providers in Valemount. I work with the Rural Coordination Centre of BC, so I'm positioned to help sort of coordinate and facilitate that process. And so here we are. We're being brave and we're trying it out.
Right. So I have a lot of questions, but I guess the first one is a private-public partnership. How rare is that to happen in this type of in this field, in the medical field, for a project like this?
Well, actually, Bright Health is a nonprofit organization, technically speaking. But to answer your question, I think it's pretty rare, especially these days in the context of COVID. There's not a lot of capacity that people have to take on new projects where it's not perfectly certain how it's going to end. So back to my earlier point, I think that requires inspired leadership and people with a vision. And it just so happened that we were able to find that in Valemount.
Yeah, that's great. So, Kai, can you tell us a little bit about why Northern Health is interested and is involved as a partner in this? Why?
Yeah, I think ultimately Northern Health is in the business of helping support delivery of healthcare. I would imagine why. I guess I would question why wouldn't we be here if we weren't here. But ultimately, it was a, you used the term fortuitous, and I think that was a good term. Like, it seemed like almost by happenstance, all of us got together. All of us had kind of a sit-down discussion, and we all just said, this is a great idea. We need to do this. And it just makes sense. As we move forward in healthcare, getting patients their information is becoming more and more important. Like, we have the technical capabilities, and we're really aiming to use those more and more.
Right. So it's taking some of the logistical challenges of the medical profession, getting tests to people in a timely manner and having access to that information, but it's also giving people a more hands-on involvement in their own health care, would you say?
Yes, I would. I think that's very, very well put. It's all about patient activation and engagement in their own healthcare.
Right.
It leads to healthier people and better outcomes, and everyone just has a much better time when things flow smoothly. I think we can all agree on that when you go see your physician and things go smoothly and you get the information that you need and want, you end up leaving happier. And the providers say they're happier too.
Right. Well, I mean, certainly you're taking some of the workload away, which is appreciated by anybody, right? Yeah. But it also allows people to have more of a hands-on approach. So just walk me through the process. So what happens when you come in to do these registrations? So you're here in Valemount for a couple of days, and you're doing registrations for the system.
Yep.
What's involved?
Not much, truthfully, and that's what's beautiful about it. So all one has to do is present themselves in person with a government-issued photo ID and a personal health number. And then with our counterparts, we will validate your identification and then send you an email link. And then it's as simple that with that email link, then you can either on your own spend 10 minutes on a computer or smart device and complete your registration, and voila, you're connected to the clinic. If it's true that you have additional barriers, or you find it trickier to access your email or whatever, or need help with your computer, more than happy to sit down with whomever and walk them through that process as well. And then after, if anyone is interested in having or registering their personal health record, it's as simple as connecting in directly with the clinic, and going to the clinic and registering there.
Right. And so as soon as they're signed up, they can start booking appointments for themselves at the clinic?
You betcha.
Right?
Yep.
And they'll have access to their test results as they come back. Some of them. I mean, I know it's a process, and we spoke briefly about it. There are other systems in place, and some information will be on this. Some may be on the other systems that are out there, but it's a process. And I think it's really fascinating that a town of 1,000 people would be kind of chosen to push this through, and you spoke to why that is, because you've got good leadership here with Dr. Markham at the head of the Rural Coordination Center, but you've also got citizens, including council people and concerned citizens who are acting as a kind of an ongoing focus group. So once you've signed people up and the system is operating, what's the continuation of this process?
Yeah, so that's a good. Thank you for asking that question. Process is the operative word. Truthfully, I would say that even though it's true that right now the personal health record does add value to a patient and provider, it's early days, right? We have a vision that this personal health record will actually develop over time and iterate to become an even more compelling solution. So what's cool about this process is, with Northern Health at the table, the vendor itself, and the providers and patients in Valemount, we're going to sit down together and brainstorm around that. We're going to look at what's working, what's not working, hands-on, and we're going to dream around the art of the possible, and together we're kind of going to roadmap that process so that bit by bit, step by step, and supported by the Rural Coordination Center, develop that solution further so that in 5 years from now we can look back and enjoy a solution that's catered to this community's unique needs, dreams, and aspirations, not one that's kind of handed to you out of the box and take it or leave it. So that's what I think what's unique about this process. I don't think it's going to happen quickly,
right? But
we're going to go slow to go fast, so to speak. I think we're going to do it right, and we're going to do it with the community.
Great. And from a Northern Health perspective, how do you see this rolling out into other communities possibly?
Well, ultimately, we would love to see every community, every Northern Health run clinic adopt this ultimately. And this is rolling out in Valemount to begin with, allows us the opportunity to really help design and put in some of those features into this, so when we go to other communities, there are more features in it. Like soon to be coming is secure messaging. So you're gonna be able to get information from your clinic, and then soon after that, we're talking about you're gonna be able to message your clinic. Think secure email, right?
Right.
And so you're not going to be able to have to phone for everything. And we envision that this will help serve our patients and clinics themselves across the North. It's been proven the world over that this works. And it's just about really making sure that it works for like the people in the North, right?
I think some people, including myself, have signed up for different systems, and there's been a lot of hiccups because it's brand new. It's never been used. You're kind of the trial kind of thing. It's not exactly like that here, because I believe you told me earlier that this system was already being used by the medical profession, and now you're adding the public component, the public accessibility component, but you're not inventing a whole brand new system. It's just adding on to what's already there and already proven to be working, right?
Oh yeah, this has been in use by many physician offices across the North for close to 2 years now, I think, was some of like the early onboarding of that. And so they've gone through those initial hiccups, right? But what we really have here is this unique opportunity to, rather than some vendor within a closet somewhere developing a solution and coming and giving it to the people to use, we have the opportunity here to get the real world feedback from actual people, and we have the vendor sitting right here listening. So it's really, I think we all really enjoy this because it's just a massive win for everybody involved. Everyone gets to have their feedback in it. Everyone's at the table. We're all listening. We're all working collaboratively to ultimately achieve what we all say we want to try to do.
Right.
And Valemount's paving the way, right? Because these are tricky times for sure. It's not like the doctors have a ton of capacity. There is a risk aversion, rightfully so, right? And so there is a leap of faith that it requires some bravery to try something new. And then so because Valemount has opted to try something new, I think we're creating space for other communities to see what can work. And then I think if we look back in 5 years from now, we'll see it spreading. And it'll be kind of cool, I think, to look back and think it all started here in Valemount.
Right? Yeah, that's right. One of the things I wanted to talk to you about is many patients, many people in the system are older. They're seniors. They may not be as computer savvy as we think they are or that they will do. They have advocates, typically family members that are advocates. They have caregivers. How can the system work in that type of situation to make it better for them?
I think that this allows you to have that easy access to information. So I think just having that access through a family member, and as a family unit, you can determine who's accessing this, who's getting this information, who's talking to so-and-so or this or that, right? It allows you to be able to gain that information when you want it and when you need it. You don't need to call the clinic and wait for them to give you that information. You don't need to request it through paper and wait a month and get it, right? So you get that information there. I think something that's also important here is that for those people that really just don't want to do technology, they don't have to. This is a new option. Every other option that previously existed for how you interacted with your care team and your clinic still exists. So we're not taking anything away there. We're not replacing anything. We're just giving another option.
Right. Kind of modernizing the system, getting people that are used to doing things online, giving them an easier avenue to do that. So this piece may not, some people may not see it before you leave town. You're here in Valemount for a couple of days. You're here at the public library, you're at the senior center, and you're also at the seniors fair, which is on Tuesday. If people miss you there, how can they still register for this program?
I think that...
Go visit the clinic.
Yeah, visit the clinic. And you don't need to go down to the clinic just to register. At the next time you need to go in for an appointment, although you certainly can, but next time you're going into the clinic, if you want to know more, like you want to really understand your provider or the clinic staff's thoughts and rationale behind this, right? Give them a chat when you're next talking with your doctor. Just ask them what's on your mind. What do they think? Like, how is this working? What does this work for you, right? And then you can make that decision then, and the clinic will be more than happy to help register you. It takes less than 2 minutes to do the actual registration at the clinic. And then, like we said a little bit earlier, it takes a little bit of time on a computer or a smart device.
Sure, family member can help you,
totally.
Or even here at the public library.
And it's not overly complicated then either. It's filling out some of your information on some secure web forms. You would do this filling out an email or signing up for a new website, right? It's probably more complicated to do online banking than it is to register for My Health Key.
And it's secure.
Very.
Great. So My Health Key, that's important branding there to get into people's mind. This is called My Health Key, PHR, Personal Health Records, and it's all about having access to your records, and it's all about being able to make appointments with the Valemount Clinic right here. You're not, calling somebody in Prince George to make an appointment. You're calling, you're online right here, and you're getting instant access to the same appointment schedules that they have in the clinic, right?
Yeah, and the thing that I like about it personally, because my provider also uses My Health Key, and so I'm an actual user of the system myself. What I love about it is I will always forget that during clinic hours to call and book an appointment. It's usually kids have gone to bed and, oh crap, I need to make that appointment, right? Well, I don't need to call, and maybe their voicemail isn't full, but now I can just go online and book it when I remember it. Like, I don't need to wait for the clinic to be open to call and book an appointment. And so that is what's really, for me personally, what I love about it.
Right. Is there anything I haven't asked you that you want to get out there about this project? Without going into techno language?
About the project? What would I say about the project?
I think sign up. Register, get in there, use it. It's not hard. There are lots of people here that can help, and it's really just going to get better from here. And if you don't like something about it, say so.
It's safe.
And we can change it.
It's secure. It's free. And it's there as a resource for patients and their families and their providers to use to better manage people's health and ultimately to hope for better health outcomes. And who doesn't want to be healthier?
Exactly.
So it's one other tool in the toolbox. And so I invite anyone who's interested to try it.
Great. Well, thank you. Good luck spreading the word here while you're in town, and we'll continue to help with that branding information dissemination there for you.
Yeah, sounds good.
Good. Thank you.
Appreciate it. Thank you so much.